Hello and welcome to our presentation on managing long QT heart syndrome in children and adults in the education, care and custody sectors. My name is Joanne Caffrey and I own Total Train. So what we're going to look at then during this short presentation is to give you an awareness level of what QT syndrome is and how it needs to be managed in the education, care and custody sectors. Specific areas that we're looking at is the medical and first aid aspects and also about the challenging behaviour. So what it is then, well, it affects roughly 1 in 2,000 people. And just to compare that to some other educational needs and disability conditions, we've got Downs, which is affecting 1 in 1,000, cerebral palsy affecting 2 in 1,000, and Klinefelter's affecting 1 in 500. So this is a condition which is outside of most service users' demographics, and therefore it's essential that service providers ensure that staff are suitably and sufficiently trained in relation to this condition and what it actually means. So it is a medical condition, and therefore it's a special educational need or disability, and it's covered by the Equality Act. So when we look at managing it then, what is it? Well, it's an inherited heart problem where the heart muscle takes longer than normal to recharge between beats. Symptoms experienced by the person can include blackouts or faints, seizures, heart palpitations, and ultimately cardiac arrest and death. Symptoms can happen unexpectedly, or they can be triggered by the likes of stress, strenuous exercise or activity, physical restraint for the challenging behaviour, and also medications, and it's the medication one which is often missed. Upon identification of risk then, here we need to activate the Health and Safety at Work Act. So we now know that we've got a risk in a service user. So therefore, with the Health and Safety at Work Act, we need to identify that risk. We then need to either eliminate that risk or reduce it to its lowest level. Control measures then to try and eliminate or reduce it to its lowest level. These will include defibrillator and CPR training for all staff, care plan and behaviour management plans for the person. And even if the person doesn't currently have challenging behaviour, it's still something to strongly consider, as at any time, any person can be stressed, can be angry, and can present with behaviour that challenges. And if staff therefore are not preempted and have conducted any planning in relation to this, their response could have serious and fatal results. We also then need to look at all the safeguarding around this to ensure that the person has safe and effective care, and also the therapeutic and behaviour assessments and plans. Medicines which may trigger long QT include antibiotics, antihistamines, antidepressants, adrenalines such as epinephrine, so your EpiPen and your Jexpens, cold remedies because they may contain stimulants, anti-migraine medicines, and salbutamol, so your blue inhalers. It's essential for any service provider with a service user who has long QT that they obtain professional healthcare advice before administering any medication of any description to that service user. So even if the next of kin signs a form, then my advice to you is do not provide this, as the parent, the next of kin, are not medical professionals and may not realise the consequences of that cold remedy that they've brought in, or of that over-the-counter antihistamine that they've bought. So how can Total help you as a service provider? Well, we're a multidisciplinary team, and we're experienced at combining the legal, the therapeutic and the medical models to meet the requirements of the service user with the capabilities of the service provider. And we specialise in educational needs and disabilities, and we can provide training for the staff, we can provide consultancy for you as a business, we can also conduct the therapeutic assessments of the service user, the environment and the staff, and we can advise or complete the care plans, the behaviour plans and the risk assessments. Ultimately, Total Train is all about safeguarding vulnerable people in the education, care, clinical and custody sectors. Please do not hesitate to make contact with us for any free, no obligation advice. Either go to our website, Total Train, or you can email totaltrain@sky.com or you can contact me direct on my personal email, which is joanne_caffrey@sky.com. Thank you very much.